Welcome to Glenview Community Church, and in following the way of Jesus, we welcome all God's people to our church. And tonight, our speaker is presented or sponsored by the Speakers Forum, and that's Tom is one of the co-chairs, and then also Lauren from our WISE committee, who will tell us more about that and more about what we'll hear tonight. Thank you, Lauren.
So welcome everybody. So as Elizabeth said, so nice to see all these friendly faces. My name is Lauren Bauerschmidt, and I am the chair for the WISE committee at Glenview Community Church, and WISE stands for welcoming, inclusive, supportive, and engaging for everybody who has different mental health challenges. For those who may not be familiar, we actually started this maybe about January or February of 2020, having no idea what was coming. And we've all, of course, been through a lot this past year and continue to be. So we're just really fortunate that we can continue to learn more about mental health and how we can help each other, help ourselves to really continue, all that GCC has to have people come together and learn from each other. So I'm really excited to have Laura Fine here. This is our third speaker forum on mental health. The first one that we had was back in the fall, and it was talking about how we're going to get through the COVID-19 pandemic from a mental health standpoint. That was great, talking about different things you can do physically, emotionally, spiritually, connecting with other people, what we eat, even social media. That was fantastic. We had a second one in February that was really geared towards families with middle schoolers and the resilience that you think about what a fifth grader compared to a ninth grader and all of those changes. And oh, by the way, we're also in a pandemic. So we had that with Glenview Youth Services, which was really, I have a middle schooler, so it was especially useful for me as well, and got to put some of those ideas to use fairly quickly, and even with my older kids too. So if either of those topics is interesting to you, I can in a few minutes put the link so you can access that. It was one of the benefits of being on Zoom is that we're recording these. You can always go back and learn from them. And tonight we have Laura Fine with us. I'm so excited to have her with us. I'm sure many of you are familiar with who Laura is. She's our 9th Senate District. Is that how you say it? 9th District Senate, 9th. She represents us, and we're happy to have her here. Not only does she have a lot of experience, she's got a BA in telecommunications from Indiana University. She has her MA in political science from Northern University, Illinois. And one of the reasons that CJ Saltz had invited her is that she now is the chair of the newly formed Behavioral and Mental Health Committee, and is a member of the Committees on Environment, Conservation, Health, Healthcare Access, and Availability Insurance. It's a mouthful, but I'm excited because it means that she is caring about mental health from a very different perspective than our previous speakers. So with that, Laura, thank you, welcome, and I'll turn the floor over to you.
Thank you so much. And I personally really appreciate what you're doing, because this is an issue that impacts all of us. And the more people we can get to discuss mental health, the better off we are. Because part of what we need to do is eliminate the stigma. And mental health needs to be treated the same as physical health. And when we can reach that point, we will find even more solutions. And so just a little background is how I got to where we are today is when I first came to the Senate, there was no mental health committee. And that was one of my requests for leadership, to say that this is something that we really need to focus on. And then COVID hit. And when COVID hit, I was approached saying, this is an issue that you've been very active in. You've been carrying legislation on these issues. Would you like to chair this committee? And to me, this was inspiring. It was intimidating. And it was one of the best things that I think the state of Illinois could do for the people who live in our state, because this is an issue that really needs our attention and focus. And previously, if there was any bill that had anything to do with mental health, it would go to insurance or it would go to human services. There wasn't a dedicated committee to really focus on these issues. And now we have it. And my goal is filled with excitement. because I am so excited to see what this committee can do for people who live in the state of Illinois. Like I said, when COVID hit, more and more people became tuned in to what was going on with mental health. And ironically, before the pandemic, I had been working on telehealth legislation. And I was working with the Psychiatric Society, and we were trying to put telehealth in place and make sure that your insurance would cover telehealth for mental health services. And then the pandemic hit before we were able to pass that legislation. And fortunately, working with the governor's office, he put in an executive order to say that mental health would be covered under telehealth. This has been life-saving, because not only do we have people who are able to still continue to get the services they need, we've had providers who've been able to continue group therapy, because we know substance use disorder has gone up during COVID, and you're still able to get the help you need. And not only that, but for minority communities, telehealth has been life-saving. And the reason I say that is because prior to COVID and telehealth being so readily available, we found that many people who live in minority communities would not seek services. And part of that was due to the stigma. They didn't want to be seen making the appointment. Nobody wanted to be seen actually going to a doctor's office, because the sentiment in the community was pull yourself up by your bootstraps. But with telehealth, we've seen more people in minority communities seek these services than we ever have before. So this is a piece of legislation that we are working on right now, is to make sure we still have telehealth available, especially for mental health post-pandemic, because this was one of the things that came out of it that we said, this is really important for the people in the state of Illinois. So as chairman or chairwoman of the committee, there are a number of benchmarks that I want to be able to reach. I don't know if I'll get them all done this year, but we've got progress in front of us. First of all, like I said, I want to try to do what we can to eliminate the stigma. And I really feel like by establishing committee, we are saying to the people in Illinois that this is going to be part of our daily conversation. And we need to address something to do with mental health. And it's no longer an issue that you have to hide. You don't have to hide it for yourself. You don't have to hide it for your family members, because talking about mental health is like talking about I pulled my back. And it's just something that we need to get into the conversation. The second goal that I have chairing this committee is to look at what can we do as a legislative body to ensure that everybody has access to affordable, quality care. And I'm going to talk about some bills in a little bit that really hit on this issue. And then the third part is, how can we ensure better outcomes? And that's a huge benchmark that we need to reach. So when you look at the Mental Health Committee now in the state of Illinois, it's obviously a bipartisan committee, but we all have the same goals in mind. So this is a committee that's really reaching across the aisle, working together, trying to find solutions. So let's first focus on accessibility. You know, when we look in this area, we can, go online and find a provider, a social worker, a psychologist, a psychiatrist within our area that most likely our insurance is going to take, or if you're on Medicaid or Medicare, you're going to find a provider. That's not the case throughout the state of Illinois. We have what's called mental health deserts throughout our state. Believe it or not, I think the number is 138 adolescent psychiatrists in the state of Illinois. That is it. And most of those psychiatrists live within our areas. They're not in Southern Illinois. So the question becomes, how do you make sure people who are not necessarily living that close to a provider have access to a provider? And I passed a number of pieces of legislation, or presented a number of pieces of legislation to really focus on this issue. First of all, I have a bill that's going to be in committee next week that says that if you have either regular insurance or on Medicaid, your insurance plan has to ensure that there is a provider for you within a certain radius. Because what we find is sometimes somebody will have an issue and the closest psychologist or psychiatrist could be 90 miles away. And we don't want that to happen. So I've been working with the insurance industry to make sure that that provider is accessible. Now, it could be accessible on telehealth. And that's one of the, I guess you can say, good things that's come out of the pandemic, is that is part of the solution. A piece of legislation that I passed not last year, because not much happened during COVID, but the year before, was something called the collaborative care model. And I worked on this piece of legislation with the psychiatrists. And again, it was to focus on these mental health deserts. And what this does is it creates a model of care that allows for your regular doctor to work with a psychiatrist on your behalf. So in many of the rural areas, people are very comfortable going to their primary care physician, and that primary care physician might ask them questions that they realize that their patient is suffering from depression or another mental health issue. The collaborative care model allows that doctor to collaborate with the psychiatrist to figure out what is the best course of care for my patient. Do I have to get my patient in to see somebody? Or is this a depression issue that might require medication? And can I provide that medication? So working to get that information and help that patient is really helping people who live within our rural communities. Another piece of legislation that I'm working on that has to do with access has to do with access to information for families. So if anybody has a child or any family member who's over the age of 18, you know that you cannot get any information about their health care. And that is a big problem when it comes to mental health. So right now, the laws in Illinois are stronger than the federal HIPAA laws. So if I have a child over the age of 18 who maybe voluntarily commits themselves or is involuntarily committed to a mental health facility, I can't get any information. I can't get information on where my child was sent. I can't give them information about this is, you're a new doctor to my child. Here's information about the medication they were on, what happens when they don't take their medication, the other doctors that they've seen. This piece of legislation that I'm working on right now would give that parent or guardian or spouse in some cases the ability to communicate. And the doctor would decide if it's safe for that person to communicate so they can work with that patient. So that just gives families a little bit more peace of mind when it comes to somebody in their family who might be in a mental health crisis. Another piece of legislation that I'm working on has to do with providers getting paid. And something that I learned that I did not know about was there's something that happens in the insurance world called recoupment. And what that means is if you are a social worker or a psychologist, your insurance providers might pay you for seeing a patient and then 18 months later come back and say, well, we overpaid you, you need to pay us back. And this is a big problem for small providers because they are struggling to make ends meet. So what we're trying to do right now, and we're working with the insurance industry on this, is narrowing that window to give that provider assurance that they're going to be able to keep their doors open. Because that's one of the biggest concerns we have, that the providers out there are able to stay in business to provide their services for people who need it. When it comes to insurance, I'm also working on something called rate review that will ensure that your insurance rates, if they're going to go up, they're going to go up at a level that's reasonable and not at a level that's put in place by the insurance industry for reasons that we don't understand. Because many times that we are finding now is even though we have the Affordable Care Act still in place, people are not seeking out those plans because they still cannot afford them. And we want to make sure in the state of Illinois that everybody can afford those plans that have behavioral health coverage on those plans. Another couple of bills that I just want to bring to your mind is it's a bill called medical necessity. And that also has to do with what kind of mental health care coverage are you going to receive. So right now, let's say I have to put my child into a facility for a mental health need. Let's say it's an eating disorder. The insurance industry decides how long my child is going to stay, or my spouse or anybody else, based on certain guidelines that we are not privy to. So I'm working with an organization called the Kennedy Forum, which is an organization that works only on mental health issues, to structure the way coverage is provided in a more fair way. Because what we're finding is sometimes you might, or somebody might be getting services for a mental health issue, and then your insurance company might say, okay, we're done paying now. But they're not going to say that to a cancer patient, that, I'm sorry, we provided you with 2 chemotherapy sessions and you're finished. We want to make sure that you get the services that you need to make sure that you can have a complete recovery, and be able to live with whatever your underlying mental health issue might be. When it comes to proximity, another piece of legislation that we're working on, and I'm going to get through these real quick because then I know that you probably have questions and I'm throwing a lot of information at you. Sometimes if you live in a border town, like for example, if you're in northern Illinois and southern Wisconsin, there might be a facility close by across the state line, but in a state of an emergency, right now, that ambulance can't bring you to that facility. So let's say you're having a schizophrenic breakdown and you live in northern Illinois. There's a facility right across the border, but the only facility in Illinois is 100 miles away. Right now, that ambulance has to bring you 100 miles away. So we're working on an agreement right now that we can have those facilities that are across state lines for people to use them no matter which state they're in. It would give families peace of mind. You'd be able to see your loved ones who might be hospitalized in a closer proximity than having to drive 100 miles away, especially if you don't have access to transportation. That is a huge problem. So mental health, as we all know, not only affects insurance and patients, but it impacts all aspects of every piece of legislation that we're ever going to pass in the state of Illinois. And a big issue that we've talked about a lot this summer with the Black Lives Matter movement is who answers a call if somebody calls 911 and somebody is having a mental health breakdown. Because we know if police respond, it could escalate, even if they've had the crisis intervention training. So we are working on right now legislation that would say if there is a mental health call, we would ensure that a mental health provider goes along on that call so they can de-escalate whatever the situation might be and have better outcomes for everybody who's answering the call and better outcomes for the police who might be involved in the call and the person who's having the breakdown at that time, and make sure that they get the proper help that they need and they're taken to the facility that they need to treat themselves in that crisis situation. We're also working on gun safety legislation because death by suicide is extremely more likely if you have access to a gun than if you do not have access to a gun. And so we are trying to make sure that, we have the Fix the Void piece of legislation right now and some other bills that we're looking at to make sure that if you're in a mental health crisis, you're not going to get access to a gun because that could end your life right there. Quick story that I want to tell you. I am involved in a national organization called the Council of State Governments, and I've been on a group with them called the Healthy State Task Force. And this task force for the past 2 years has been looking into what can different states do to provide for better health outcomes for residents of their states. And so we are a group of bipartisan legislators and government workers trying to work on the solution. And when it comes to gun safety, one of my colleagues from Utah told us a story about how in Utah, where guns are readily available, he was able to pass legislation that you have to store your guns in a lockbox, and that lockbox has to be accessible through your thumbprint. And he tells us the story of actually a friend of his, and a friend of his son was going through a difficult time. his girlfriend broke up with him, and he decided he was going to take his life. So he went to his father's gun safe and tried to open it and couldn't open it up. And while he was standing there, his cell phone rang, and it was a friend of his asking if he wanted to go to the mall. And he went to the mall. Think of how different that situation would have been had he been able to have access to that gun in that safe. And so when it comes to mental health and death by suicide, gun safety is essential. And it is something that we are working on in the state of Illinois and that we have to pass to save young lives and save all lives, because you are far more likely to have, I guess you could say, successful suicide attempt if you have a gun nearby versus another means of taking your own life. Another piece of legislation that I want to focus by you, and then we'll open it up for questions, is trying to solve a problem of we need more mental health providers. We need to encourage more people to go into the field because we do not have enough providers that are out there available and accessible to people. What can we do? So in part of the Black Lives Matter healthcare pillar, we passed legislation that supports a behavioral health workforce education center in Illinois. And this workforce center is going to be focused in one of our universities. And the focus is going to be to get more and more people involved in these fields, because we've got to get them involved. So right now, 38% or nearly 4.9 million people in Illinois live in behavioral health workforce shortage areas. And this is what we are trying to solve. We feel that if we could get more people interested in the field and more people to go into the field, we will have more providers and have better outcomes as a result of it. So as you can see right now, we've got a lot on our plate when it comes to mental health in the state of Illinois. But the good news is we are really looking at what we can do, and we are focusing on how do we get the job done. And so much of our legislation comes from constituents, people who come to us and say, hey, I have an idea. You know, this is the experience I had. Is there something we could do, some way that we could work together to get this done and have better outcomes? And that's why talking to groups like this and getting together in our communities is so essential, because I need your feedback. I need you to say, you know, I heard you talk about that bill. I don't think it's going to work. Or did you ever consider this? And so that's where I think our conversation needs to begin tonight. So I'm going to open it up to questions.
You are very busy. And I am happy that you're very busy because there's clearly a need, as you have said. And I like that you said one of the biggest things was to bust through the stigma. We've talked a lot about that in our group, and I think that that's really huge. So if anyone has a question, we're kind of small enough that if you want to kind of wave your hand, you know, and unmute yourself, go ahead. So Carol Bauer, did you want to start? Go ahead.
Yeah.
Boyer, I apologize.
Not that this is my field or anything, but I'm kind of curious if they've ever thought about this from the sort of the prevention end of it, because if you go on, I think it's on the CDC website, and you look at this screening test for adverse childhood experiences. Mm-hmm. There's a group of 10 questions, and people who score, it's about family, it screens for several different at-risk situations before the age of 18, and people who score 4 or more on this screening quiz have an incredibly higher risk of mental illness, addiction, and a bunch of physical health problems like diabetes and obesity and heart disease and all that. And so is there, you know, obviously there's still current need, but coming down the pike, can people do, can the state do a better job of screening for this kind of early childhood adversity, trauma, whatever you want to call it, and mitigate it early on? It would save, would save people, you know, a lot of problems with their mental and their physical health. It would, you know, it would save cost. It would save people's, you know, the quality of people's lives.
Absolutely. And that's why we need to invest more money into mental health, not only in the state of Illinois, but nationwide. Because if we can find these children and provide them with the services they need, they can have a full recovery. But these are issues that if we just let go, like you said, it never will resolve itself. But as a society, if we can get to the root of the problem and find out who these children are and who've suffered from these ACEs, then we'll really be able to get it done. And a lot of that has to do with investment. And I know State Representative Deborah Conroy, who chairs now the Mental Health Committee in the Illinois House, and I have been ringing this bell in everybody's ear on we have to invest more in mental health because if we invest in it and work on the problems early on, it's going to save us a whole lot of money later on and a whole lot of lives.
I mean, this is like, it's a simple screening. It's very simple. And, you know, they could screen for at their annual exam, they could screen maybe in the school. I mean, I don't know, but it's, you know, it's pretty simple, and it could, you know, you can't read the future with it, but, you know, it could give a better picture of who's, you know, at higher risk.
Absolutely. And I'll see if they're doing something like that in other states and how it's going, because I'm not shy of stealing ideas from other states, because if there's something working, why not try it here? And I know this is something that we've discussed in the Council of State Governments. And so that's a great idea, Carol, and I'm going to see where I can learn about it.
It's on, I think it's on the CDC website.
Okay.
And I'm going to sign off. I have to take this call.
Okay.
Tom, go ahead. Tom Aldridge, then Betsy.
Laura, thank you for all that you're doing. We really appreciate it. And some great initiatives happening in Springfield. Could you comment on what the bipartisan landscape looks like for supporting these initiatives?
It looks really good, which is, you know, everybody hears about, oh, Democrats and Republicans, they don't get along. These are issues that nobody can escape. If it doesn't affect you, it affects a family member. And I would say that everybody who's sitting on this committee is very, very in tune and concerned about mental health issues. And, you know, interesting, because when this committee first started meeting and I had some pieces of legislation, I thought, oh my gosh, what am I going to be up against? And when we would take a roll call and I would get unanimous consent, I was shocked and pleasantly surprised. But this is one of those committees where we put politics aside and we're focusing on the issues that can get done. When it comes to now funding, that might be different. But with these pieces of legislation that I've explained to you, we've got bipartisan support, bipartisan co-sponsors on many of these pieces of legislation, and we're really working together. Now, that's not to say that the original bill doesn't have some concerns that we work out together, but this committee is really working together well to get things done.
Great, thank you.
Thank you. Betsy, why don't you go, and then Lumi, I see your hands up, so why don't you go after Betsy?
Am I on? I don't. So I kind of like Tom, I want to sort of know a little bit about what are the things among this that you feel are most likely to have movement, or where you would want to have the support of, you know, people in the local people down in Springfield to help push it along. Which things are really moving and you think might be doable easily?
Well, I think all the pieces of legislation that I mentioned tonight are moving, and we're most likely going to get them through. Some of the pieces of legislation I talked about, I've already passed. Others, if they're not quite ready yet, they might be ready next year. But I really feel like the climate right now is focusing on mental health, and we got to strike while the iron's hot. Well, we really have this collaboration going. So here's an ironic story. I had a piece of legislation in committee last week, and I'm a Democrat, and I tend to be progressive. And Darren Bailey, I don't know if anybody is familiar with him, but he's a very, very, very conservative Republican from Southern Illinois who might be running for governor. I ran one of my bills in committee. I got a call from him afterwards asking if he could co-sponsor it with me. So I know that was kind of funny. But it just shows you that these pieces of legislation that we're pursuing, like I said, sometimes it takes a lot of work. We've got different industries that might be involved, different interests that might be involved, but the core here is we really want to be able to help. And with, like I said, with the legislation that I mentioned, I think we can get it through. There are two bills that I've been working on that are a little more challenging than the others. The first is rate review, to make sure that the Department of Insurance can ensure the people of Illinois that the rates that the insurance companies are charging are viable. A little background on what that means is when the Affordable Care Act passed, every state had to do something called rate review. And what that means is all the policies that are going to be sold in the state of Illinois have to go to the Department of Insurance with their rates, and the Department of Insurance reviews their rates. 38 states have teeth in that. And when I say that, what I mean is if a rate goes up more than 10%, their Department of Insurance can say, we went through this with our actuarial, configurations, and we think it's going up too much. We're not going to let it go up that high. In Illinois right now, we don't have those teeth in our law. So what this rate review law would do would give the Department of Insurance that ability to tell the insurance industry that, I'm sorry, we think those rates are too high and we can't let them go that high. So that's one piece of legislation that's a little challenging. The other is my medical necessity bill that would allow for certain guidelines to, I explained this bill before, it wouldn't allow the insurance company to decide what your course of care would be. It would allow your doctor to decide what your course of care would be when it comes to mental health. And that one, the insurance industry does not like very much. Mm-hmm. And so I'm having a little bit more challenge getting that one through, but I'm hoping that we can reach an agreement. So those are the two bills I would say, if you want to hop on them, hop on.
Wonderful. Lumi, go ahead.
Thank you, Laura, for your presentation. Hello again. So you had talked about the collaboration between primary care and psychology, psychiatry. Mm-hmm. And so that's great. But I will tell you that, for example, from the primary care standpoint, I feel like, and I will only speak for North Shore as a personal user of the system and a provider within North Shore. The primary care doctors feel completely at a loss as to what is going on with mental health treatment. So okay. On Monday, I had my daughter's physical. She turned 12, and yay, she did her very first on her own depression screening. And as we were going through, and I gave the doctor updates from her psychiatrist and her therapist, he said, "Wow, thank you for letting me know. I would have never known. Unless a person is in the emergency department, I have no access whatsoever to any of the notes, any of, really? Even if her psychiatrist adds a new problem to her problem list, it's not viewable anywhere within her Epic charts in North Shore."
Really? Okay.
And so that's a huge barrier. The other thing that apparently, and I'm about to learn about it next week at a follow-up visit, there's something that happens between the age of 12 to 17, where as a parent, you're no longer allowed to request refills on your child's behalf. However, the child is too young to request refills. And this was explained to us when we first started. And, she was so young at the time. And I'm like, oh, whatever, we'll deal with it when we get to it. But I'm like, oh dear, now she's 12. And what was it that you told us? It's completely, even from the psychiatrist standpoint, they're confused as to why or how this is even possible. But there is they call it a huge gap between the age of 12 and 17. I don't understand it. I think it's scary if you're not able to have that same continuity of care, especially when it comes to medication management.
Okay, so Lumi, you and I are going to have to talk offline.
Yeah.
So I can get more information about this and find out, because that just sounds ridiculous. So
and I'm told it's not a North Shore thing. I'm told it's a law thing, and that I don't know anything about it.
Okay, and either do I. And this is why it's important that we have these conversations, because that sounds like something that needs to be changed. So
thank you.
We'll talk tomorrow.
I
have a question. So Lumi's question sort of sparked a question that I had earlier. So I know that it's important sometimes for the safety of the child for their care to remain private from the parents. And so how does that work in conjunction with what you're talking about, Laura?
With the piece of legislation that I was discussing?
Yes.
That's why in this legislation, the doctor can decide whether or not there's going to be that communication.
Okay.
Because if the doctor feels it's not safe for the patient, then it won't happen.
Okay, I thought I heard that.
This is over the age of 18. Because under the age of 18, it's very different, because then parents do have access.
In some states, they don't have access. I know, and I don't know I know the threshold in Michigan is, but I don't know what the threshold here is. It's like 15 or 16 in Michigan.
Okay, I'll have to find that out. But yeah, this piece of legislation clearly states that if the doctor thinks that the patient is in any danger as a result of that, especially with domestic violence issues.
Right.
We don't want that access available.
Right.
But in part of this legislation too, the doctor might not give the family information, but the family can give the doctor information. So if that person who's in that mental health crisis can't communicate their past history or the medications that they've been on, the family can give that to the doctor. And right now they can't.
Oh, okay. Thank you. That clears it up. Thank you.
Oh my goodness. I am overwhelmed with a lot of this. For me is learning some of what I have experienced and some of just being a part of this group. And so to hear something that is not black and white, to try to be put into black and white into legislation is a challenge, and trying to figure out all these ins and outs. So I think that this kind of forum, like you said, Laura, is really helpful, so that we can hear these different perspectives and kind of understand, this is what I saw, this is what I'm feeling, this is what I know, so that then you can take that to the different groups that you're on. That Healthy State Task Force sounds like a really great resource, to learn what other folks are doing.
And I have to say that so many of the pieces of legislation that I'm carrying have to do with constituents who had issues. And as a result of the issue, we're changing the law.
Yeah, that's great. Karen, did you have a question or a comment? Go ahead.
I just wondered, Laura, what can we do to help support you in your ventures here?
Absolutely. So first, I would ask that everybody signs up for my newsletter, if you're not signed up for my newsletter, because we will send out information on the pieces of legislation that I'm carrying. And if there is a bill that you are in support of, when that bill comes to committee, there's something you can do. It's called filling out a witness slip and saying that you support that legislation. And that's very helpful for me, because then I know going into that committee hearing, this is a piece of legislation that my constituents support, and it's very important for me to get it passed. Also, if there is a piece of legislation that you hear about and you think it's important to pass, let me know. Put it on my radar screen. For example, I had one of the school superintendents reach out to me just yesterday asking me about a certain piece of legislation. Well, that's a bill that was filed in the House, and there were about 4,000 bills filed this year. So I hadn't even heard about that bill yet because it hadn't come over to the Senate. So he put it on my radar screen, and now I'm aware. And you might hear about, through different emails you get or different groups that you belong to, different pieces of legislation. Email me about it. If it's important to you, make sure that I know that it is, and so that I can put it on my radar screen.
Good question, Karen. Other questions, other comments? Cindy, go ahead.
Hi, Laura. Thank you so much. I had no idea there was so much legislation that was in the works, and I'm really, really happy to hear that you're leading the charge there. My question has to do a little bit with kind of the silo of care that happens. So you were talking about with the primary care provider and being able to access or link in a psychiatric provider. I've also seen and actually experienced where there's very much a silo between maybe a therapist and a psychiatrist, and trying to connect those two that might be in different groups and have them communicate so that there's a real continuity of care is really challenging. So I don't know if you've heard that before, but I wanted to share that.
Not that I've heard of it, I've experienced it. When, personal life experiences, for those of you who know me, and this is why I am so interested in this field, in this area, is it's almost 11 years ago. It'll be 11 years ago this month. If you've ever seen me with my husband, he's got one arm. And the reason he has one arm is he was driving to work one day 11 years ago and hit head on by a truck. And that truck amputated his arm at the scene. And we went through a lot of issues with insurance, who didn't want to cover anything. And the person who hit him didn't have any insurance. And this was before the Affordable Care Act. And our provider said, we're going to repeal your coverage. We're not going to cover anything. So we struggled. And unfortunately, a part of that struggle was when my husband came home from the hospital after 5 weeks and was trying to get used to life without one arm and not being able to go back to work and having chronic pain. And at the time, we had no mental health care coverage because this was before the Affordable Care Act. He took a bottle of pills, and my son and I found him and had to, by force, bring him to the hospital and have his stomach pumped, and then he went through the process. But in that process, leading up to that, he was seeing a psychologist and a psychiatrist, and the two were not communicating. And so his course of care was very splintered. And it resulted in something that I want no other family to ever go through. But I do have to say, when you do get the proper care, it's something you and your family can overcome. Because as Cindy knows, because she sees me and my husband walking the dog all the time, he's doing well. He went through a very difficult time, but when he got the supports that he needed, and he got the doctor's care that he needed and the services he needed, you can come out of it on the other end. And that's why we have to make sure that there is this communication. And I will talk to the Psychiatric Society and the the psychologists also to say, what are you doing for continuity of care? And is there something that we need to work on together to make sure that patients get the care they need with that communication? Because there's many times that you'll go and you'll talk to a psychologist, but you'll see your psychiatrist once a month so they can prescribe the medication. And how do we make sure that they're communicating and everything's on the right path?
Thank you. Thank you for sharing your story. I think that that can be hard, and yet also it helps remind all of us that we probably, everyone on this call is touched in some way by a mental health challenge, whether it's ourselves or someone we love deeply. And that's why we're just all here, and we're a part of this group with GCC, and want to help each other. So thank you for sharing that. And I actually just went through the mental health first aider training, and one they really talked about was recovery, and that it is possible. So it's encouraging to hear your personal story with your husband of finding what he needed and getting those resources and out walking the dog. That's great. So that's wonderful.
And if you've never seen Cindy's dog, it is adorable.
I go out, go find it too. This has been a fantastic discussion. We still have a little bit of time if someone has any other questions. If not, maybe Laura, if, you could send us or send me the link to sign up for your newsletter.
Absolutely.
And then we can make sure that gets to everybody who either is actually on the call or who registered but plan to watch later. And then we can support you as you support us and make this a real partnership. So any other questions, any other comments?
I just want to echo what Lauren said, and thank you so much for taking time out of your busy schedule to be here. I learned so much, and it's so valuable for all of us to think about how we can work together to just take the stigma off of mental illness and to have it just be, we talk a lot about, and when we ask someone how they are, it should be, or how they feel, it should be the entire health, not mental health or physical health, but just health. So I appreciate that. So Lauren, what do you think?
Yeah, I guess, Laura, do you have any final thoughts or comments? Or Elizabeth or Betsy, go ahead.
Just Laura, just with all the money that's coming into Illinois, do you know, or does anybody know what might be earmarked for mental health?
I don't have the dollar amount, but there is money that is earmarked for mental health. Also, Lauren, I don't know if you have that. Did you get the slide that I sent you with the resources in Illinois?
Mm-hmm.
So there are a lot of resources I want to put on everybody's radar screen that are provided in the state of Illinois. And some of the CARES Act dollars are going in to help support these services. One thing that I really want to put on everybody's radar screen, if you see it up there, it's Illinois' Warm Line. And this is a phone number that you could talk if you just need to talk to someone. If you're having a moment and you want to talk to somebody, a professional, to talk it through, this 866-359-7953. Many people don't know about it, but it really is life-saving, because sometimes you could just pick up the phone, talk through it with somebody, and they can help give you the direction that you need to take that next step.
That's really helpful. Go ahead.
Oh, no, go ahead.
I was going to say, again, with my little training over the weekend, having that number in your phone can be helpful if you need to share it with somebody who needs it as well. So I've started putting some of these crisis lines in my phone just to have at the ready. So that's a good one. I didn't know about that one. Thank you.
It is. And I know some states, like, for example, Utah has a text for high schoolers. That's something that we're looking into also, that if they're having a mental health crisis or they need support, they can text that number and somebody will call them back like right away to make sure. Because we all know when you're in crisis, you can't wait a month to talk to somebody. You need to talk to somebody right now.
Absolutely. Thank you again. This has been wonderful. Laura, just thank you so much. Oh, Tom, go ahead, Tom.
Just a quick commercial.
Oh, yes, please.
This is the 7th of our speakers forums for this year, and the 3rd, as Lauren mentioned, sponsored jointly with Speakers Forum and the WISE Committee. Our last Speakers Forum will be the first Wednesday in May, which I think is May 5th. And it's going to feature Professor Ian Hurd from Northwestern University. Ian is a professor of international law and is a Canadian citizen. And he's going to talk to us about our neighbors to the north, what Canadians think about America and Americans. And I think it's going to be both a very interesting as well as entertaining program. So I encourage everybody to try and join us that first Wednesday in May to hear Professor Hurd.
And you
Thank
can find the information on that program and other programs we've done on our website at www.gccucc.org. And we want to make sure that our friend CJ/Cindy knows that we said that tonight. So
Yes. Yes, we need Cindy points.
all right.
Yes, absolutely. Well, thank you again, Laura. This has been great. Thanks to all of you for participating and asking good questions. And I think we should all take Laura up on filling her inbox with ideas and recommendations and ways we can connect, because she's really going to be out there, you know, pushing for these things for us. And the more information she has from us and support, the more successful we'll be. So
Yes,
thank
and
you.
also a project possibility for next year, if you come up with a piece of legislation that you would like to see passed, focusing on mental health, we'll work on it together. And it could be a group project, and we'll get it done for the people in the state of Illinois.
That'd be awesome.
Perfect.
All right. Yeah, that's cool. All right, we
Totally.
have lots of ideas and we'll keep talking, right, Lauren and Laura?
Absolutely.
So, all right, everyone have a good night.